We're going to talk about exercise now. It used to be that women who weren't active before, we would not encourage them to start being active in pregnancy. New evidence from 2019, the Canadian Guideline for Physical Activity Throughout Pregnancy, is saying that exercise is a critical component to a healthy pregnancy. And the goal is to aim for 150 minutes of exercise per week. So if we break that down, that's about 30 minutes 5 times a week. You can even break it down more or like into shorter intervals, so maybe 10 minutes in the morning and 20 minutes at night, however that works for you. And what they found is that women who were able to achieve 150 minutes per week, we saw a 25% reduction in depression, as well as 40% reduction in high blood pressure and preeclampsia, which is a more serious condition, as well as a 40% reduction in gestational diabetes. So with exercise, what we want to remember here is we're looking at activities such as brisk walking, stationary bicycling, elliptical, so an elliptical machine or a step machine that you can do inside, as well as you can do like yoga or aerobic exercise that's held by a certified yoga instructor who knows how to work with pregnant women, because there are some modifications that you might need to take when doing these aerobic or yoga exercises. Something to keep in mind though, if you weren't active before, to start slow and work up to that 150 minutes per week. So that might be, maybe you go for a 5-minute walk twice a day, see how your body is adjusting and feeling with that. It's also, you should go speak with your primary care provider to make sure that exercise is something that you should be adding to your healthy pregnancy regime. And because there are some conditions that you shouldn't be exercising. So some conditions in pregnancy that your primary care provider, such as your midwife or doctor, will know about with you, and they can discuss that with you, what form of exercise you should do or shouldn't do. Other benefits of exercise include decreased back pain, better sleep, increased blood flow to your uterus, placenta, and your muscles. And that's because your heart is going to be pumping more and pushing that blood and that oxygen to those areas of your body. You'll have a better recovery postpartum if you've been exercising throughout pregnancy. You'll have stronger muscles for labor and delivery and more endurance. You've been exercising your body to prepare for that marathon of labor. It also decreases constipation, which many pregnant women struggle with constipation. So by moving those muscles, you're able to move things through your bowels more easily, and many women find relief in that. It promotes healthy pregnancy weight gain, and that's also really important for stabilizing blood sugars in pregnancy as well. So how do I know I'm overdoing it with exercise? So persistent contractions is not something we should be noticing. Bleeding from the vagina. Swelling in like your legs that you didn't have before and suddenly comes on, or in your hands, your body. Increasing pain to your pubic area, your back, as well as dizziness, shortness of breath, excessive fatigue or being really, really tired, difficulty walking. Changes, if you notice any changes in the movement for your baby, that's also a sign you might be overdoing it. You may also, if you noticed any swelling in one of your legs or redness to one of your legs, that's a sign as well that you're overdoing it. And that's when you should definitely see or call your primary care provider about and get that looked at. So in general, exercise is important, and we want it to be part of a healthy pregnancy. Speak with your primary care provider about what kind of exercise is appropriate for you. If you have any questions or concerns, reach out. You can speak with a public health nurse, your doctor, midwife, about what that looks like for you.